What do you guys feel when, let's say, for example, patient Maria comes through the door and they're like, "Hey, Noemi, hey, Gabby, I'm back." I don't know about you guys, but to me, sometimes I'm like, oh my God, it's been 6 months.
Do your research before you go into a clinic to make sure they have all the verifications they should have.
Unfortunately, not everybody has good experiences at dentals, and we try to help them. We do our best.
Hello, welcome back to Supreme Dental Podcast Studio. You could be anywhere else in the world right now, but you're here with us, and we appreciate that. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. Don't forget to like and subscribe. We have a phone number and an email address. Any questions you guys have, go ahead and send us questions and concerns, and we'll get back to you. And remember, this show is for you, the patients. But today, we have two special people here at Supreme Dental. We have two of our receptionists that take care of all of our patients. When you call any questions, concerns, we have Noemi and we have Gabby here.
Hello.
Hello.
Now, remember, we're not professionals, so this is something that we are doing for you guys so you guys can stay informed, so you guys can get the inside VIP on what it's like to be at Supreme and any other questions that pop up. So ladies, I know that you ladies were just at the clinic. You are at Supreme Dental Clinic, and you are at Cosmetic Center, correct?
Correct.
So I know that one of you is extremely nervous, and the other one is probably nervous also, but she knows how to keep it in a little bit more. So these we get a lot of questions. We get a lot of you guys have fans. You have people that really, really like how you guys help them out. And obviously, we really appreciate that. We have patients that come and they're scared, or, they flew in from very far away. And the first thing they want to see is someone that helps them out, takes care of them. What are some of the things that you think that you guys encounter the most with patients that come in for the first time? What are they to expect after you guys? Because you guys control the shuttle. You control the shuttle. You guys normally, sometimes you guys are the first person that they actually speak to on the phone. So what are some of the suggestions that you guys may have for those patients when they come in for the first time?
Okay, one of the suggestions is for them not to be nervous coming down to Mexico. There's a lot of patients that are concerned about the danger there is in Mexico. I let them know that the town is safe, that it's a pretty small town, safe, and there's a time that after 5, everybody's gone. So it's pretty calm, and they can just be sure that they're going to be safe in town.
Yeah, that's a fun fact. Algodones pretty much shuts down after 5 o'clock. All there is outside in the streets is like hot dogs and tacos, and that's pretty much it. So it's a pretty boring, safe town.
Yeah.
So that's very, very important. What else would you guys like to tell the patients on what for them to expect the first time they come down?
I think the first time they come down, they're going to expect is the pickers. So that's people that's at the border when you entrance. They're going to be telling, come to my clinic. They're going to give you cheap prices. Just do your research before you go into a clinic to make sure they have all the verifications they should have.
That's actually very, very important, because when you cross the border, they're going to tell you whatever they need to tell you, whatever you want to hear to get you in their clinic. Now, there's amazing clinics in Algodones, but there's also some that are not so amazing. So it's very important that whenever you guys do your research, you know exactly where you want to go, and you guys follow through. Maybe if you guys need a second opinion, go for it. But very, very important that you guys follow through and don't just listen to someone when you cross the border, because you don't know where they're going to take you. You don't know what clinic you're going to end up in. And obviously, they just want to get you in to get some money. So they really, really don't care about you. So those are pretty good points. What else do you guys normally see?
Well, I personally talk to the patients directly, since I'm always calling them to confirm their appointments, shuttle, and I'm also in touch with them by text messages, and their concern is like I said, the danger. And once they're coming from Phoenix or San Diego shuttle, I let them know what the procedure is. We usually have the driver coming down to Mexico with the patient, so they feel more safe.
So, Gabby, let me know a little bit about you shuttle, because you are in charge of the shuttle from Phoenix and San Diego, if I'm not mistaken.
Yeah.
So, pretty much, how does that work? How does a patient know who picks them up? How does it work?
Okay, so I text the patients. I call them first, and I let them know that I'll be texting them so we can be in contact with them. And I let them know the shuttle driver's name. We have Francisco. And basically, when he's arriving, when he's 30 minutes away or 15, I call the patient and let them know. And they give me their exact point. So I let the driver know so he can get there and pick them up.
Okay. And then after that, they drive them across the border and they drop them off in front of the clinic?
Yes. We bring them down to Mexico and drop them off in front of the clinic.
Now, tell me a little bit about, a lot of patients, as I know, have kind of a problem with staying in Mexico. You know, they're like, is it going to be safe to stay in Mexico? You do most of the accommodations, or both of you guys do, but the accommodations on the hotel. So what do you tell those patients that are scared to stay in Mexico? And first of all, where's this hotel at?
Okay, so we usually recommend our patients the Baja Hotel, which is only for supremedental patients. It's right next to Cosmetic Center, so it's very easy to get to. And also, it's very safe.
So another thing, obviously, patients don't know what it's like to be down here, right? So Supreme Dental Clinic, it's located inside of the plaza. How far do you guys would say that we're away from the border?
I say 3 minutes walking distance.
3 minutes walking distance. Okay, so we're extremely close, maybe like 40 yards, 35 yards, give or take.
Probably, yes.
Okay, so now that they're here, because one of the main concerns that we get also is, where am I gonna eat? Is there places around here that is it easy to find food? How does it pretty much work?
Yes, we usually recommend the restaurants that are the nearest from our block. There is more restaurants, but there's Pita Strip that I personally like. So I always recommend our patients to go there.
Yeah, no, that's good. That's good. I normally recommend patients inside the plaza. There's also inside the plaza there's a restaurant that's inside the plaza. I normally recommend that allow for breakfast because they have pancakes and eggs. A lot of our patients come in and they get work done, from crowns to extractions to implants, and they need soft foods. So they got the tortilla soup, they got all that stuff going on.
Welcome to Dental Facts. Did you know that dental implants have a 97% success rate? You heard it first at Supreme Dental Podcast. Floss, brush, and keep smiling.
So let's say at cosmetic. So you walk into Cosmetic Center, okay? I'm a new patient. What am I to expect? What do I see when I walk into Cosmetic Center?
First thing you're going to see is the huge waiting room. We have a coffee station for the patient. We have water, coffee. We have tea. And you're going to see the reception. You're going to see me. You're going to see 2 huge TVs on. And that's pretty much it.
That's fair. So we have tea?
I don't think so. But it's been requested by the patients quite a lot of times.
Okay, so. Because then we should probably get tea. Because I was like, well, I'm pretty impressed because I didn't even know we got tea. So you do see 2 85-inch TVs. There is a large waiting room. We try to make it as comfortable as possible. We like to have neutral colors. The floor is light. You know, we have the grays. We have the high ceiling. Very important. I'm all about light. I like light. I don't like where it's dark or it's dim. I like to be able to see everything. But with that comes, obviously, if anything is dirty, you'll be able to see it. So that's why we keep it so clean, for the same reason, to make sure that everything looks as good as it's going to get. Now, obviously, you work at Supreme Dental Clinic, which is right across the street. The same family, but different clinic.
Right.
So now, what do I see when I walk into Supreme Dental Clinic?
Well, our reception is different. It's a bit smaller than Cosmetic Center. So we have patients also being impressed because the clinic is so clean and bright as well. So we have a lot of happy patients, thanking us for that everything's clean, the restroom, every area that they see is clean.
Okay. To me, one of the main things is when I walk into, I'm extremely picky, as you guys know. But when I walk in somewhere, I like it to be clean. I like it to, one of the main things is how I see it and then how I smell it. So to me, it's very important. That's why we keep the candles that we do have are vanilla, which is one of the things that help people with their anxiety the most. Because most of our patients have had a bad experience with a dental clinic or just don't want to be there. We get a lot of patients that are, I can't wait to get my smile, but we get a lot of patients that are like, oh my God, I'm so nervous. You get the nervous yet excited. It's a good combination, but it could be pretty tough. So that's one of the reasons that we do it. So you guys work with many assistants that keep this place clean. What is it like answering? Because I know we have numerous phones. Tell me about the day-to-day basis. Tell me about you guys talking to different people from different parts of the world. You guys get to be there when the patient says, thank you. Actually, I just seen a video when a patient takes a picture with you. How does that feel? Because you guys are part of Supreme Dental Clinic. And a lot of times we think, well, the doctor changed this person's life with a new smile. I think that's half true. Because I think that if it wasn't for the assistants having the place extremely clean and having the doctor with everything that they need to perform whatever it is, the patient would have walked in and everything would have been dirty and they would have been like, I don't care who works here, I'm out of here.
Right.
As well as you guys being able to make it so easy for the patients to get here. So I'm in New York. I don't even know what an algodones is or how patients call it. Algodones or something like that. People, they don't know what it is. And you guys get to tell them, hey, so this is how close we are to the border. It's going to be very safe. We're going to make sure you have a hotel to stay in. So I believe that the doctors do 50% of the work and everything else is done by everybody else, including you guys. You guys are a very big piece to Supreme Dental as a team. Without people being in the front, you guys are the first faces most of the time that the patients see. That's why I'm very, very particular on you guys having your face on, because you guys have to be at your best. And we get that all the time. My teeth are amazing, but I want to thank Gabby because she really helped me out. Or you know what? Noemi really told me how it was from the beginning. And that's a big point that I want to touch on, because we're not order takers. So we don't just, oh, you want to do this? Let's go ahead and do it. Or, oh, you want to do that? Let's go ahead and do that. So you guys are a big part of that. Now, tell me about, do you guys live here in town? You guys live like a block away, or where do you guys live?
Yeah, I think that's one of the questions we get asked quite a lot. I don't live here in town, but I do live in another town, which is about 15-minute drive from here, from Algodones. And it's very safe as well. What about you, Gabby?
I live in San Luis, Sonora, and I take an hour to get to work. So it's an hour drive back and forth.
What time do you guys come in at? You guys come in at 8 o'clock? Because the clinic opens at 8. Are you guys here at 8, or what time you guys here at?
We get here around 7:15.
7:15 in the morning?
7 a.m.
Yeah, I know. Sometimes you used to come in at 6:30
Yeah,
or
back
6.
in the days, I used to.
So, and what time do you guys walk out at?
It's usually 5, sometimes 6 o'clock, 7 o'clock. It all depends on how much work we have that day, but it's 5 o'clock.
So you could definitely say that, obviously, maybe you guys don't feel it that way, but you guys are a big part of Supreme, because you guys are staying to be able to communicate or to answer any questions with the patients that are still in receptions, that are going to take payment. You guys are responsible for all those things, right?
Yes.
That's right.
So when you guys get home, You guys are both single, right? And with no kids.
Yeah, right.
So you guys have kids?
I
Yeah,
have
we
4
have-
kids.
So you have 4 kids and you have
3 kids.
3 kids. So you guys get out of work at 5, 6, or 7, and you guys still have to go be super mom.
Yes.
Okay, so that's one of the things that I feel that our patients sometimes don't understand is that when you guys come to Supreme Dental and there is a lot of patients in reception and you have Gabby working and you have Noemi working, you know, sometimes people forget that you guys are also humans because you guys sometimes appear as robots because you guys are working so hard and talking and this and that, but you guys still have to drive and be here at a certain time. You guys still have responsibilities to do out of here. And that's extremely impressive. So, like I said, I feel that most of the credit sometimes goes to the dentist, but they don't see everybody. I feel that, I don't know if you guys ever heard the thing that says a champion is only, becomes a champion. It doesn't become a champion in the ring. They're just recognized there. So I feel that a smile is not done just at the chairs. Everything there is behind it. And you guys are part of that dental journey. How many times have you guys talked to a patient that says, hey, you know what? Thank you so much. You guys, this changed my life. Well, what do you guys have a patient in particular that you guys remember? This is out of it just came out of left field. Something that you guys say like, wow, you know what? This patient, it really got to me, or this patient, it was something like, wow. Who, do you have somebody like that?
Yes, actually, we had a patient, Gordy. He was really excited after all his treatment was done. He actually wanted to take a selfie with me after he was just running back and forth. Gabby, I'm so happy. I'm excited. I can smile. I'm gonna be able to eat some meat. That's what they're more excited about, eating meat.
Being able to eat the things that they no longer did. What about you, Nomi?
Yeah, actually about 2 weeks ago, we have a patient that he was having teeth for the first time in 10 years, I believe. And he was very, very happy. He was very, very grateful. And his wife was also very happy.
And how does that make you guys feel? Because to us, sometimes, people may think, oh, it's just another patient, but lives are changed.
It's a life changing.
They're changed. Sometimes people come for just a look, but sometimes they come because they want to be able to eat. And obviously we could eat whatever we want to eat, but there's some patients that can't. And I don't think steak tastes the same when it's blended. We want to be able to bite into that ribeye. So, how does that make you guys feel? I mean, what is it like to you guys?
Well, we've had different patients with different situations, as in some are just wanting in for aesthetic, and some to be able to eat. They don't care how they look. They just want to be able to eat. So there's a lot of different cases, and unfortunately, not everybody has good experiences at dentals, and we try to help them. We do our best. We all put, a little bit of...
A grain of salt.
Yeah, of salt. And there is, I would say probably there is a 90% of the patients that are happy with their treatment. And like I said, unfortunately, it doesn't go as good for everybody, because it's just different situations.
Yeah, I wouldn't be too happy after they pulled my teeth and did implants. I mean, maybe I'm happy in the long run, but at that point, I'm not the happiest or feel the greatest. Oh, well, that's awesome. That's awesome. So what is one of the things that you like the most about what you see here that makes you feel that the most complete?
One of the things I like the most is when patients come from their second stage. That's when the first part of the procedure it's over, which means the surgical part, which is the implants, extractions, or bone grafting. I mean, obviously, the first stage is not very easy to take.
Okay.
And so when they come for the second stage to get the final teeth, it's very rewarding to see the results when they get their permanent smile.
What do you guys feel when, let's say, for example, patient Maria comes through the door and they're like, hey, Noemi, hey, Gabby, I'm back. I don't know about you guys, but to me, sometimes I'm like, oh my God, it's been 6 months. Like I feel like I feel
Yeah.
like I just seen you like 3 weeks ago. Like I feel like
Exactly.
everything just passes by very quickly. Has that ever happened to you guys?
Yes,
Yes.
actually.
That's pretty crazy how you're like, oh my gosh, 6 months, and then you even look at the file. Oh yeah, you came in January. Now we're in July. You know, it's pretty crazy how time flies when you're having fun.
Yeah, that's actually one of the comments sometimes I make to our patients, because when they're, for example, when they come for an Allen 4 or Allen 6, and they say, I'm going to have to wear dentures for 6 months. And I say, obviously, it's not that easy, but when you let's think about it, 6 months are gone and you'll be back for your new smile. So just be very patient and you get the best results within 6 months.
And most of the patients that are going to be with dentures for 6 months have been with bad teeth for a lot longer than that. So it's
Right.
just a period of 6 months. It is 6 months, but it will be over and we'll be ready to go.
Yeah.
No, well, that's great information. Now, let me know a little bit about some of the hardest situations you guys, because not everything is sunshine and lollipops.
Yeah, it's not.
So tell me about some of the hardest situations you guys have had to deal with.
So we've had patients that are in for their final hybrid, and during the test of the final work, they approve the work, and then afterwards they're not too sure about it, and they change their mind and they want to redo it again. So it's the doctors, the lab, and everybody else is trying to do the same work in a lapse of less days, just for the patient to be satisfied with the work.
So then we have some patients sometimes that come in for their final work and they choose a material. And then
You could say-
throughout the time, then on the second or third day, they want to change to a different material, a better material. And then all of a sudden we got to start from zero, but they only have so many days to work with because, so I see. So that is a little bit hard to explain to the patient. So what do you think would help the patients so that doesn't happen?
Well, it's it's about helping, but the patient needs to be sure if the final work that they approved is what they're going to stick with. And if the patient is not too sure about it, I'm thinking maybe that we should give them an extra day so they can think about it to see if they're gonna want to change the final work, or are they going to approve it.
Oh, okay. So then perhaps staying here a little bit longer, or already coming in with, this is what I want, doing the
Yeah.
research
Yes.
in the meantime. What about you? That's one of the hardest things that you encounter.
Probably one of the hardest thing, it might not be like the hardest, but as a receptionist, is the waiting time for the patients. Like sometimes like a surgery takes longer than we expected. So we have another patient waiting for that doctor that's on surgery. So it's just pretty much sometimes time goes out of our hands and we have the other patient waiting a little bit longer than we tell them it's going to be. So for me as a receptionist, that's one of the hardest.
You know, and that's
Situations.
actually something that I wanted to touch up on. So for you guys that are listening to us out there, let's say that we are on a surgery that we say is going to take about an hour. So we say when we say an hour, we already gave us at least a 15-minute, gap to be able to have that. But sometimes things happen throughout the surgery and we just can't say, okay, well, sir, your hour's over, sorry. And we move on to the next. But one thing the patient needs to understand is that when it's their turn, we will take as long as it's needed to get things right.
Exactly.
Because if we do the things right, then they won't have to come back later on with their teeth in their hands or whatever it is. So we make sure we take the correct time. And sometimes we are a little bit later. Sometimes we're a little bit sooner. But it is every work is custom. Everything is different. There's no like one size fits all. It's not like, oh, here you go, have some teeth. We got to make sure that it's the right for your face, the right for your mouth, that it seals completely. So it's custom work. And some patients really, really like say, hey, you know what? Don't worry. But I have noticed that some patients are like, you're 15 minutes late.
Yeah.
But when we're at the chair with them, we might take 15 to 30 minutes more or even more to make sure that their teeth is the best possible.
Yes.
Well, actually, right now, our videographer just told us, is there somebody you guys want to say hi to? Is there anybody that you guys want to say, hey, anything like that?
I think I would like to thank each and every one of our patients for choosing Supreme Dental for their dental care. It's not that easy to come into Mexico and do your dental care, but we do appreciate you choosing Supreme Dental. So I want to thank each and every one of you.
Thank you.
And that was not a commercial. I promise. I did not tell him to say that at any point. But we do appreciate you guys' business. And we do understand if I was to fly into China, and I will be terrified. No matter how many videos on Instagram, no matter how many podcasts we do, patients are going to be scared to come to Mexico, perhaps. And they were fed this image of Mexico.
Yeah.
And this image of what to expect in Mexico. And that's why we do these type of videos, because people don't get mugged when they're eating tacos. All we're doing is changing people's lives with new smiles, or giving them the chance to eat whatever they want to eat again. But I want to thank both of you ladies for doing this today. I know it was on a short notice. Actually, I told you guys yesterday. And I believe Noemi told me, well, what's the script, or what are we going to say? And I say, well, it's freestyle. So we're just going to talk, because to me, that's natural. And that's what patients want to see. They don't want to see a script. They want to see what they get. We're transparent. So what they see is what they get. And so thank you so much. I know that Noemi is extremely against all cameras in the world.
I am.
But I think you guys both did great. So thank you for that. And we want to thank each and every one of you for being able to watch this podcast. Remember, don't forget to like and subscribe. And we'll see you soon. Thank you.
I have a question for you.
Go for it.
So you're always asking questions. So I would like to ask you a question.
All right, go for it.
So how does it feel to be the CEO of one of the top dental clinics in Algodones, the number 1 and 2 agencies?
Oh,
how do you do it?
This is the first time that this wasn't scripted either. So if you guys don't see Noemi next time you guys come in, you guys know why. I'm just kidding.
I didn't ask anything.
But how does it feel? Well, obviously it makes my wife and I feel proud. Sometimes I feel that even though now we have 7 accreditations, which is the most that any clinic in Mexico has, and they're international accreditations. They're not from the town next to us. They're from the United States. And obviously we're completely proud, because without you guys, without the team, we can't do that. But we don't, we're happy, but we still don't feel like it's enough. So we feel that the more we scale, the more we see that there's a lot of other things out there. We're about to get, as you guys know, the PIC Dental, which comes from Spain. And it's the only impression in the world that's 99.9% precise. That's insane.
It is.
And we're going to have people from Spain coming over to train us, and you guys are going to be part of the training also.
Yes.
And you guys know that we're going to Singapore next year, and we're going to be 10% of Mexico. 5 of us are going. Only 50 chairs are there for people from Mexico. And we have people that have been to Switzerland, Argentina, Spain, Curitiba, Brazil in August with Dr. Ivan, Harvard University. And I really feel that there is a lot to do. And I look around, and there's a lot of dental clinics here in Algodones. Like I said, there's some really good ones. There's some other ones that just like anywhere, anywhere in the world, but we don't compete with anyone here. We look at other parts of the world and see what else is out there. We run our own race, and I think that's what made us different. And obviously you guys have made us different. So thank you so much for that. And with that, I'm going to close the episode before I get teary-eyed. So you guys have a good one. See you next time.
Thank
Bye-bye.
you.
Thank you.